Because when we work together, anything is possible.
Hello, everyone. Thank you, and welcome to CloudClinic Medical Laboratory Onboarding webinar. Thank you very much for joining us. Welcome, everyone. Good morning, everyone. Welcome to the second CloudClinic Medical Laboratory Onboarding webinar. So very quickly, we are going to be starting. So if you are just joining us, kindly drop your name and your state, that's your location, in the chat box. So drop your name and where you are joining us from. For instance, my name is Ololade and I am joining from Lagos. So you can just drop your name and where you are joining us from in the chat box, and then we'll begin. So while you're introducing yourself, I would like to introduce the panelists for today. Our first panelist is Mr. Ifeanyi Aneke. He's the CEO of CloudClinic Limited with 14 years experience working in the technology industry. He has worked for several IT and financial service companies and helped them build innovative products. His work experience spans across international IT and software companies such as Microsoft, where he worked as a cloud solution architect covering the Middle East and Africa, in charge of a select next-gen high-potential accounts in the region. Welcome, Mr. Ifeanyi. It is an honor to have you here. The second panelist is Flourish Unamdi. Flourish Unamdi is the product manager of CloudClinic Limited with over 5 years experience as a business developer and product manager in the financial services industry. He is certified in product management and digital payment by Lafati Group, and he holds a Bachelor of Science in Economics from Landmark University. Also, another person that will be working behind the scenes with us today will be Amaka Ezekwesili. She is our program coordinator with a blend of experience that cuts across several industries. She has worked 10 years in the construction industry, a year in finance industry, 3 years in the business sector, and 2 years in the manufacturing industry. Also, I'll be introducing another panelist to us in person of Ejiro Gene Pepe, who is a highly skilled analyst and sales professional with a track record of driving business growth and optimizing sales through data-driven strategies. She's our business development manager and she will be joining us today. She has backed several certifications from international organizations, including Amazon, Microsoft, and Meta, and she has about 6 years working experience in the business development space. And also my humble self, I am Ololade Olaleye. I'm the clerical associate for CloudClinic Limited, and I will be your host for today. Thank you once again for joining us. I can see that a lot of people are already dropping their information. So I have Ifunanya from Abuja. Thank you very much. I have Ira Bonusa from Edo State. Thank you. I have KK Emmanuel. Welcome, Emmanuel. I have Blessing. We have Donald from Enugu. Thank you very much for joining us. We have Rufus God Gift from Port Harcourt. Thank you. We have KK Emmanuel is joining us from Lagos. Thank you. We have Fasheyi Kayode joining from Ile-Ife in Osun State. We have Olale Konsani joining from Lagos. We have Blessing joining from MedPlus. Welcome. We have Basi Grace Umfon joining from Kwarimpa in Abuja. Thank you very much. And also joining us is Chris from Lagos. So if you are just joining us, kindly drop your name and where you are joining us from in the comment section. So in the chat box, pardon me, so we can begin. So for those that are just joining us, welcome once again to the second CloudClinic Medical Laboratory Onboarding webinar. This webinar is designed for those that have partnered with us and those that haven't partnered with us to help you understand your partnership with CloudClinic better. How do we get paid, which is of course very important, understand our house rules for our partners, amongst other things. So part of what we'll be doing today, Flourish, if you could please kindly switch to the slides. All right. Yeah, so, okay, I have Osita Dima from Ogidi. Welcome, Osita. So part of what we'll be doing today, what you'll be doing today is the introduction to CloudClinic. We'll have an introduction to CloudClinic. You'll be able to understand who a CloudClinic partner is. When we say a CloudClinic partner, you'll be able to understand it and how you as a medical laboratory come in. Of course, how the CloudClinic app benefits our partners. We'll be introducing you to the CloudClinic partner app as well. We'll be talking to you about our house rules. There will be a graphical presentation of the onboarding process. And of course, there will be frequently asked questions, and then you as the audience will be able to ask questions as well. So if at any point during the presentation you have questions, you can drop them in the Q&A section, or you can wait till the end, in which case you'll be able to raise up your hand and then we'll give you permission to speak, and then you will be able to ask your questions. Thank you once again for joining us. I will be handing over to my CEO now. Over to you, Mr. Ifeanyi.
Thank you very much. Good morning, everybody. Very happy to have you here. Like Lola said, this is our second MedLab onboarding webinar. The last one was great. We had very good turnout, a lot of questions and lots of insight from you guys. So we're happy to have you here again as we go through this onboarding webinar. And I have an announcement to make, which I believe most of you would love to hear, because this is something that I believe will benefit every single MedLab in this webinar today. So let's get started. Now, the question is, what is CloudClinic? I'm sure a lot of you have these questions ringing in your head today. I'm trying to understand exactly what is this CloudClinic that everybody's talking about? What does it really mean? So CloudClinic is a medical platform that connects different players in the health industry by providing a solution that works for doctors, patients, and health facilities alike. This journey started about 9 years ago. That was when the idea for this dropped, and we've been working in the background and marinating on this idea for quite a while, consulting with different stakeholders, looking at what other people that have tried to do this, did, and what they failed and what they succeeded in, and we've been really tweaking this product to what it is today. I'm glad to tell you that CloudClinic will be launching on the 18th of April. And what we have is not anything close to what you've seen before in the industry. We have a platform that is orchestrating the interaction between different stakeholders in the healthcare sector. And the idea is great. Let's go to the vision. The vision of the company is to provide access to quality healthcare for everyone anywhere in Nigeria. And that's a very, very bold vision. To say you're going to provide quality healthcare to everyone is daunting. And to do that for anybody anywhere in Nigeria is even more daunting. But we believe this is possible. We actually do believe this vision is achievable in our lifetime. And that is because of a couple of things. First of all, we built a very reliant technology. I'm going to talk to you about that in details. We've used modern technologies that are prevalent today to be able to build this solution. But we've also seen a surgence of a lot of other supporting infrastructure. Internet penetration is getting much better. We've seen, the likes of Starlink that is touting being able to provide access to internet anywhere in Nigeria and the other parts of the world. And it's affordable, it's even more affordable than most of the players today in internet service provision. So this is definitely something we believe will help us drive this. Now, the question now is, how do we plan to achieve this vision? What is our mission exactly? Our mission is to engineer the future of healthcare with focus on access and convenience through technology. Now, this specifically is talking about looking at the challenges that exist today in healthcare and figuring out a way to use technology to make it much more accessible and much more convenient. That is exactly what we hope to achieve with this, and that's what we're doing. So we have a research office in Lagos, Nigeria, where we have a couple of engineers from different structures working together and figuring out this solution, while also engaging with some of you. There have been a lot of engagement with the stakeholders, in the industry. There are conversations that we're doing with different medical doctors, med lab scientists, pharmacists, people that own some of these businesses as well, reference hospitals, the government regulatory bodies, the PCN organizations in Lagos, in Abuja, in Enugu, the MedLab Directory Guild as well. All of those conversations are going on. We're trying to figure out what is the best way to do this, and then using modern technology to do that, to achieve that. So let's look at some of the constituents of these services that we have, and how this is really helping drive this move. So the first thing is that we're relying on cloud infrastructure. I'm talking about the exact same infrastructure that is reliable and is used by very reputable organizations all over the world. So Azure is being used today by US Defense Department, and many other reputable organizations are using the same technology. So it's very reliable, and it's well maintained. So we know very reliably that this infrastructure will be available, and you have very little network downtime, as it's called over here. So you're going to have a very reliable service using what solution that we're providing. The other thing we're also doing is the use of smart devices. So our smart devices, it helps a doctor to be able to do consultation from wherever he is using our technology. Right. So what we have, one of the services we're providing is the ability for a doctor to be able to do a virtual consultation with a patient. And to do that, the doctor needs to be able to know the vitals of this patient. Now, we've partnered with different manufacturers to be able to come up with a device that is very smart. It's easy for anybody to be able to use those devices and check his own vitals. And that information is fed to the doctor, and the doctor will be able to do a proper consultation with this patient. So that's what we're doing with smart devices. Now, we're also using our GPS technology to be able to guide the patient. So when the patient is done with the consultation and the doctor recommends a particular investigation or prescribes some drugs for that particular patient, our technology would guide the patient to the nearest pharmacy or to the pharmacy that the patient chooses to go to, so you can guide him with turn-by-turn navigation direct to where that pharmacy is, or where that med lab is in this case. So this is really helping us to be able to make sure that there's convenience, and for patients that want home sample delivery or home sample collection or home drug delivery, this GPS technology also guides the med lab or the pharmacy that is directing, that is coming down to meet them there. So all of these things are well taken care of by that technology. We're also working with licensed facilities. So there's a lot of this issue that are prevalent today where you have challenges with different service providers that are not providing the right services. So we have, we're not partnering with like patent medicine stores or anything. We're partnering with only licensed facilities to make sure that our patients get the right service that they need to be able to deliver these services. All right. And then we're also working with specialists. So on our platform, there are both, general practitioners, there are, specialists, there are consultants, everything you need to be able to deliver, the right service to your patients is what we're doing here. So let's move on to the next slide and talk about our partners and why they are our strengths. All right, great. So our partners are our strength, like I said. And when I say this, I truly mean it, because CloudClinic cannot succeed in this mission without our partners. You are our strength. You are our representative you are the one that is there when we're not there. You are the one that is helping us in the last mile delivery to these patients. And so if you look at this slide, you see some of the partners we've partnered with. We don't have all of them here. I think the total number right now is about 75. We have a lot of partners that are queued up, about at least about 900 and something are currently reviewing our partnership agreement, and we have some gate in place to make sure that we bring in the right people and get to the number that we need to get in. So if you have not partnered with us already, this is the time to do that. Towards the end of the slide, there will be a link that you would see that you can click on to submit your information to start the partnership process with CloudClinic. But truly, our partners is our strength. You are the one that really helps us to be able to get to the last mile. And then the question is, who really is a CloudClinic partner? How do we know someone that's supposed to be a partner for CloudClinic? The first one is that a CloudClinic partner is a member of the CloudClinic directory. And this helps these partners to be able to get a lot of exposure. So on our app, we have a directory for all our partners. So it would help you, we'll work with you to be able to provide that visibility that you need to be able to increase your sales. The other aspect of it also is our CloudClinic partner is also reputable. There's a credibility in place here. We expect that a CloudClinic partner is a credible partner, is someone that is reputable as well. Is also someone that adheres to international best practices and standards of healthcare delivery. We only partner with people that have a track record of standard delivery to their patients. A CloudClinic partner will also have access to our technology and resources as well. So there's a lot of technology we're building, an inventory solution we're working on, certain integrations, even some work we're doing. We're trying to figure out how to really make your own process today a lot better. A CloudClinic partner would get access to these technologies as we churn them out first before it goes to any other part of the world. Now, a CloudClinic partner also provides mutual support system as well. So what I mean by this is that a CloudClinic partner we kind of work together with you. So CloudClinic is your partner and you are also our partner. So we're making all this effort to try and see how we can work together to help your business. And at the same time, we expect the same thing in return. So it's really a partnership. When we say partner, we mean that, it's truly a partner. Of course, we've talked about the licensure requirements. You have to be licensed to be a partner of CloudClinic. And in this case, we're talking to MedLabs. You need to be licensed by MLSCN for you to be a member of our CloudClinic medical laboratory partner directory. All right. So now let's talk about the benefits. So what are the benefits of being a CloudClinic partner? The first one is increased visibility. If you're a CloudClinic partner, you have, grown your visibility is amazing. You would be presented to a bulk of people, a bulk of patients. So it's beyond you just putting a signboard in front of your med lab. We have a lot of partnership we're doing with different media companies. There's a lot of work we're doing with advertising. We have a lot of patients on our platform. That's by you being a member of that directory, you automatically have that visibility. The second thing is that we're going to be sending patients to you. So, and then with the turn-by-turn navigation feature that we have, it would help them to really get to you without any problems. Now, the next one is about revenue generation, right? Clearly, there's a lot of revenue opportunities and that would happen if you're a partner with CloudClinic, right? There's a whole lot that you would start to gain because as we are directing more of these people to you, definitely your revenue will increase tremendously. Let's move to the next slide. There's also, the access to prompt payments, prompt payments. So there've been a lot of, during our consultation with different, stakeholders in the industry, especially the med labs, there were conversations around the issue where, some people even asked us to say, are you a HMO? We're not a HMO, by the way. We're not. We are orchestrating these interactions. In fact, we're having conversations with HMOs on how we're going to bring them on this platform as well. So, but part of the challenges is that some of these HMOs don't pay on time. One of the things we're going to do is to make sure that if you're partnering with us, you get access to prompt, payments as soon as you deliver value. We're not even talking about, 30 end of the month anymore. And that's one of the announcements I'll be giving to you further down the line. Just wait for that. Next slide, please. Now, the other one is wide client reach. So this is also more like visibility, but then this is talking about the fact that you're no longer restricted to that particular region. With our network of partners across, you'll be able to really expand easily. You get patients from far and wide, so you really begin to enjoy the advantage of being an online medical laboratory. So the home sample collection options are there to be able to deliver samples to you, and you can service patients that are far and wide. And the advantages, is beyond imagination. Next slide, please. All right. So this is the announcement that I was talking about, right? In part of the as we were doing all of these webinars and having some of these consultations, there were a lot of feedback from some of the partners saying that having to wait till the end of the month to receive the money for the different investigations or the drugs that they sold is not really the best for them. So I'm happy to announce to you that CloudClinic will be releasing, as part of our first release on the April 18th, our partner wallet system. And what this means is that as soon as you deliver value to a patient, as soon as you upload the result of your investigation that you did, instead of waiting till the end of the month for you to receive that money, you get the money credited to your wallet immediately, and you can withdraw that at that instant into your bank account. I'm going to leave Flourish to go into the details of what this means and how this would work, but this is really exciting. The partners we've spoken to about this and how this would work are very excited about the opportunity. So I'll turn over to Flourish to take it from here and then explain not only how the wallet system works, but how the entire CloudClinic partner application works to you. Thank you very much. I'll be here. There's going to be questions towards the end. When we get there, we'll be glad to answer your questions as well. Thanks, everyone.
Jesus. All right. Thank you so much, sir. Good morning. Good morning, everyone. My name is Flourish. Thank you. And I'm standing on all existing protocol. Special thanks to the host, Lola, and also special thanks to the CEO, Mr. Ifeanyi. So I'll go right into it. I'm introducing the CloudClinic partner app. All right. I know there are a couple of questions, our audience would have asked. The first most important question is, okay, how does this wallet work? How will I get my money? Second question would have been, or how am I going to, display my services? At the same time, questions would have been asked, how exactly are you going to route patients to our facility, irrespective of where our facility is?
Where are we on now?
To answer that question, all right, I'm introducing to you the CloudClinic partner app. The CloudClinic partner app essentially orchestrates interaction between our partners and CloudClinic. All right. What that means is you're able to communicate effectively with the CloudClinic partner app using you're in essence, you can communicate effectively with the CloudClinic using the CloudClinic partner app. Now, moving to the next slide, I would go deeper into what you can do with the CloudClinic partner app. One of the things that we've been able to introduce in this product is being able to manage your facility across different locations, all right? We understand that when you partner with us, there are tendencies that you might have 1 or 2 branches in different parts of Lagos, you might have 1 or 2 branches in different parts of Abuja, and various states in Nigeria. And we've designed a solution that simply helps you manage your facilities across different locations using a single app. Essentially, what that means is, as a partner, when we create you in our system, you are at liberty to assign the locations of your facility to different managers, that is to individuals who you know are going to manage them. So what that means is you're in control of who manages your facility, and you're also in control of the records and also the revenue generated from each of those facilities. Moving into the next slide. Another important question is, how exactly would CloudClinic be able to route patients to my facility? If I run a medical laboratory today, how will patients be able to locate where my laboratory is? All right. One of the things that we've designed in our partner app is the facility activation. We understand that today we've leveraged on the GPS technology to use that to give our patients turn-by-turn navigation to where your facility is. All right. So in essence, in using the CloudClinic partner app, part of the process of activating your medical lab in this case would mean that you have to take pictures of angles of a facility, which would include the outer facility, the outer area of your facility, the entrance into your facility, and also the reception area and the equipment that you have. All right. Interestingly, we have a demo video which we're going to show you that also explains how to go about this process. So using those images that are captured, we are able to efficiently direct our patients to where your facility is. We don't even need to contact you to say, oh, please send us your address. All we have to do is just display an exact location that gives the person the accurate distance to where the facility is, and the person is able to locate locate you. Moving further down, we have another key feature here, which is the inventory list upload. All right. One unique thing that we've done with the partner app to serve our partners better is to create an intelligent system so that you don't need to change your templates. You don't need to modify your template. All right. We understand that, yes, there are separate services, separate tests that are done by different facilities. And we've designed something that is just going to capture the type of the investigations you do, and the prices for that investigation, and also the turnaround time for that investigation. So essentially, our system learns your template and matches it with ours. Therefore, you can keep using that template whenever you want to. So if you have a new investigation test that's being conducted by your facility, all you have to do is just include it, and you can either include that in your new template, and upload that to our system, or you can manually update that using partner app. Then another very important thing you can use the partner app to do is the price updates. All right. We understand that the market, the prices in the market changes. All right. The cost of reagents and the logistics that are put in place can also change. So we've designed a simple solution so that you can update the cost of the tests that you run in your laboratory. So you can do that using the partner app without even having to contact us. You can do that immediately, and that updates on our system. Now, we've also included something here that talks about notifications and orders. And a question that I know I haven't answered is, how do I get paid on CloudClinic? All right. For every order that has been sent to your facility, what we've designed is a notification so that you're prompted of a particular investigation request sent to your facility. You're also sent an information which is contained here on the screen that shows the information of that patient, the doctor's information, as well as the necessary tests that are required for you to conduct on that patient. And once you're able to upload the results, you get credited immediately. So at the point of you uploading the result of that investigation, you get credit into your wallet. So in essence, we've developed a system so that you can easily track your orders, the orders that are sent to your facility, and at the same time, you are also notified of when a patient is coming, and you're able to confirm, you're able to upload the investigation using the partner app and get paid. Now, this is a quick customer journey on how to activate your facility using the CloudClinic partner app. Also, there's going to be an introductory video which will be played after I'm done with this slide. So the first is to visit the URL here, get.cloudclinic.ng/partner, CloudClinic partner, download the app. Once you've downloaded the app, you enter the email address that has been assigned by your facility, by the partner, or the email address that was used to create you once we do that on the back end. The next is to upload input the OTP that was sent to that email address. So this is just a second level verification to be sure that that email address is valid and the email address also belongs to you. Once you're done, you also displayed an information of your facility. So what we do is also to confirm that the facility information that we've captured in our system is also accurate. This includes the name of the facility, the address of the facility, the email contact of the facility, as well as the logo of the facility, because we don't want to misinterpret or we don't want to misrepresent our partners on our app. Once that confirmation has been done, you're moving into the next step that shows you instructional steps on how to activate your facility. I've mentioned it that first you need to capture certain angles of your facility. At the same time, you also need to ensure that you grant permission for the location to capture once you're capturing those images. That way, we can effectively communicate to our patients where your facility is located. Then the next thing is for you to upload your price list. We understand that today you have there are price lists that are used by your facilities, which will also include the kind of test that has been done, and at the same time the cost of those tests. So you're expected to upload that in an Excel sheet using the partner app. And once that upload is done, the process is complete. So this is just a short instructional step on how to activate your facility. Going into the video, I'll be playing a video for you, and this video also shows a more detailed step on how to use the partner app. So it's able to capture the process of being able to assign a facility to a manager. It also captures how to activate your facility and upload your price list. And it also captures how to set up your wallet. So for those that have questions on how to set up their wallet, the video also captures that scene.
Here's a quick guide to get started using the CloudClinic Partner app. Download and install the CloudClinic Partner app on your mobile device. A partner is registered by the CloudClinic admin and has a unique ID generated for them by the admin. To assign a facility to a manager, open your CloudClinic Partner app. Log in with your email and partner ID, and verify the OTP sent to the entered email by inputting the OTP in the app. Proceed to the next page to see the list of branches owned by the partner. Branches are ordered based on activated and non-activated in 2 separate tabs. From the list of inactivated facilities, select any branch to activate or assign to a facility manager. To assign a facility to a manager, click on Assign and input the name and email of the facility manager. Ensure the account setup and withdraw permission is turned on to allow your facility manager setup account and withdrawals. To activate a facility as a manager, log in with the email address assigned by the partner. Verify the OTP sent to the email. Confirm the facility details assigned to you. Then proceed to carry out activation of the facility by capturing angles of the facility, including the front of the facility, the entrance, and equipment. Next, upload the price list of your facility and look out for a conflict notification at the top of your screen. If any, click on the notification and proceed to resolve them by clicking on the drug or test, then selecting from the suggestions drop-down on our list or indicate can't find. If you wish to continue on your web browser, click on the link displayed below on your screen to continue to the web, or check your email for a link and follow the prompts. Remember, you don't need to upload another list, as our system saves your previous upload. For notifications and order confirmation, click on Orders, located on the bottom navigation to go to the order screen. On the order screen, you will find 3 different tabs: the pending orders, delivered orders, and fulfilled orders. Select pending orders to see the recent orders sent to your facility. Managers can search for an order by using the patient's name or order ID as displayed on the receipt provided by the patient. Select pending orders to see the order details. This will contain the list of medications or recommended investigations from the CloudClinic doctor. Finally, proceed to click on the Confirm Order button at the lower part of your screen and input the confirmation code provided by the patient to mark the order as delivered. Your facility gets credited once the order has been confirmed or marked as delivered. To set up your withdrawal account, once your facility has been activated, click on More located at the lower navigation bar of the home screen. Select Wallet. Next, click on Withdrawal Account. Input your bank name, account number, and account name. Then finally, click Save. That's it! Leverage the CloudClinic Partner app to grow your revenue now. Here's a quick guide to get started using the.
Good morning, everyone. It's a pleasure to have you all here. My name is Adrian. I'll start on the existing protocol and I'll take it up from here. I'll use the next couple of minutes to walk us through our house rules. These are regulations and guidelines that are going to be guiding our relationships with all our prospective partners. So it's important that we'll walk you through this. I would want us all to be attentive and then, of course, drop our questions at the end of it all so we can attend to them. So these house rules are mandatory for pharmacists and have been prepared to assure the partners, which in this case will be you, of your rights while creating the most favorable platform for the best healthcare service delivery. And the first rule we have here is on licensure. The first rule we have here is on licensure, which is very important to us, right? We need every of our partners, in this case, pharmacists that want to sign up with us, to be fully registered under the Medical Laboratory Science Council of Nigeria and the Ministry of Health. And then also ensure that practicing licenses are renewed when due, as our team are going to be routinely checking that your licenses are still valid. So it's important that you renew them when due. Then the next housing rule is going to be on identification. As an affiliate medical laboratory, you must identify CloudClinic patients from the information that will be sent to your facility. The next one is going to be prompt service delivery. Once an investigation request is received, ensure that the investigation is carried out immediately the patient or the sample arrive at your facility. What this does is that you ensure that all investigations are properly carried out and accurate results are uploaded, then spurious and or incorrect results are not allowed. They are not allowed. The next rule is going to be on quality services. As a partner, you must provide standard services to CloudClinic patients promptly and without unnecessary delay. The next rule is going to be on ethics. The affiliate medical laboratory must practice within the ethical guidelines provided by the appropriate authorities, which in this case is the Medical Laboratory Science Council of Nigeria, and of course, any other regulatory authority. Then all concerns of the affiliate medical laboratory should be emailed to partnersupport@cloudclinic.ng. So after signing up with us, if you have any constraint, you have any challenge, something you think we should know, we always have open arms to listen to you and open ears, of course, to listen to you. So you send all your concerns to partnersupport@cloudclinic.ng. The next rule is going to be on monetary remittances. My colleagues have talked about the monetary part, so this is just to set the guidelines to it. Partners are required to upload investigation report. Pardon? Partners, so I'll just take that again. Partners are required to upload investigation results. Then the agreed markup or rebate will be deducted from the funds and balance remitted to the affiliate medical lab wallet. So when you are using the application, you have a wallet that you can withdraw from at will at any time of the day, right? Immediately you have uploaded the results, you will get your money after the rebate has been deducted, credited to your wallet immediately, right? And then withdrawal from the wallet will attract bank charges, of course, to attract bank charges. Then the next rule is going to be on confidentiality. The affiliate medical laboratory must respect the patient's rights to confidentiality as stated by the law in the partnership agreement. So of course, before you become a partner, there's an agreement we need to send to you, and then to make sure that both parties are clear on what is expected of them. So if you would like to go through these house rules on your own, these are the link here. You can use these links to, access the house rules. And then if you want to download the application, my colleague will be dropping the links in the comment section. If you want to download the application, you can also, use this link to download the application. Then if you want to apply to be a licensed partner with us, then the link there is also what you need to click on. Before the session is over, my colleague is going to drop the link for us, for those of us who will be downloading the application and applying as a licensed partner. Then, as my MD has mentioned earlier, we're going to be launching on the 18th of April, and we are super excited. We are all looking forward to it, and we hope that you are doing the same. So from April 18th, we're going to be live. We already have patients, we already have partners who are waiting for us to launch our product so it can start being in use. So we are hoping that everyone on this call, if you are yet to sign up, we're hoping that you will also pick up the form and then partner with us before the day is over. Yeah, so I'll just move on to frequently asked questions. I'm sure we all have questions, we have concerns, we need clarity on something. So these are the questions that we get asked frequently. I'll take the next couple of minutes to walk us through it. And of course, you have the opportunity to also ask your question in case it wasn't captured here. So the first question here is, when will I get paid for the investigations I do for CloudClinic patients? And the answer is right here. The patient pays for every investigation before the test is carried out, and the total fund remitted to you once the investigation results have been uploaded in the partner app. By total fund, this means that the rebates would have been deducted, right? Remember at the monetary rule, we talked about rebate. So after that rebate has been deducted, every other money, the total money that is applicable to you will be remitted to you immediately in your wallet. Okay, so of course, if you need more clarity on this, you can also throw in your questions, we will answer them. All right, so the next question here is, how will I get paid for the investigations I do for CloudClinic patients? Again, the answer is right there. CloudClinic will credit your wallet in the app once the result of an investigation request has been uploaded in the application. Before the patient will come to your facility, they have already made payments, but we need to be sure that the investigation has been carried out. And the only way we can guarantee that is when the results are uploaded. So immediately you upload the results to the application. Once the investigation request has been uploaded, the request, not results, please pardon me, the investigation request, investigation request, not reports. Those are two different things. Yes. So once the investigation request has been uploaded, you will get credited in your wallet. The next is, how will I recognize a CloudClinic patient? And of course, the answer is right here. A CloudClinic patient will present a CloudClinic investigation request form, and the form will contain the details sent to your email and indicated in your application. So for every request that is made to your facility, you will get a notification in the application, and you also get it in your email, so you know that patient ABC is coming to your facility. And when they get there, they'll show you the form, and then of course you can see it on your application. So that's where you identify that this patient is from CloudClinic. The next question is, how do I update the price list? Yes, price list is very important. And we understand that these things changes. So you have to take the responsibility of making sure that your price list is accurate on the app. And we have made it easy for you to upload them at once using an Excel file, right? So you don't have to upload them one after the other. You just maintain your inventory sheet, right? And then you upload it through the CloudClinic partner app. You can also upload them one by one if you so choose to, but you can also upload them together in an Excel sheet. So that makes it easier for you. Then once the price change, it's easy. Just look for that particular investigation and then upload just that one. What happens? Okay, what happens if what happens when a patient wants to do investigation outside the requested investigation list? Okay, it is easy, it is simple. We can't control what are the medical needs that our patients need. So the patients reserve the sole right to request for the investigation. But however, any investigation not marked as paid will be paid for by the patient. So what that means is that if a patient comes to you and they want to do a typhoid test, they want to do a malaria test, but on the app, they only paid for typhoid test. And then when they get to your facility, they decided based on their conversation with the doctor that they would want to just do the malaria test as well. You have to make them pay for the malaria test on site, since that wasn't paid for on the application. So take note of that. Then the next question is, how frequently do I receive my money as a CloudClinic partner? Easy. You can request for withdrawal anytime of the day, anytime at all, 247, as long as you have access to the application and you have the authority to do that. You can request for your money, withdraw it at any time, because immediately, remember, we get payment from the patient, and then investigation has been done, we are crediting your wallet. So the money is available there for you to withdraw. So you can withdraw it at any time, as long as the investigation has been carried out and the results have been successfully uploaded. And then, of course, let me just reiterate that there are no limits to what you can withdraw for now. It should just be based on the bank charges. Then must I upload my price list on the CloudClinic partner app? Yes. You have to upload your price list on the CloudClinic partner app. Price list upload can be done in the app. However, the app also allows you to use a desktop browser to resolve conflicts during upload. So while you are uploading, perhaps you made a mistake with one of the prices or one of the products label, that's the name, you can always correct that, go back to the price list and correct that. Okay. Yes, so I think this is the last FAQ we have here, but like I mentioned earlier, you might have a question that wasn't captured here. That is absolutely welcome. So you want to make sure that you bring those questions to us. And then these are various platforms that we use should you want to connect with us after now, for us to provide you more information about how the product works, how the application works, or you need more clarity about the house rules generally. You can reach us via Instagram. You can reach us on WhatsApp. You can reach us on Twitter. You can reach us via LinkedIn. You can reach us via Facebook, and you can even send an email to us. You can check our website also. And before this session is over, the link to this will be shared with you. So it's easy. It's just one click through, and then you have direct access to us. You can do it to reach us through any of this platform, and then we'll be sure to take your questions. So thank you so much for your time. We'll be taking the live questions now, and my colleague Ololade will be championing that. Mic check, Lola.
All right, thank you very much, Ejiro. Thank you very much for those for the amazing presentation, everyone, from the CEO, Mr. Ifeanyi, to Flourish, our product manager, and then Ejiro, our business development manager. I hope everybody was able to grab as much as they can. So some of the questions you've been getting have been surrounding if we will be sending you resources after this, after the webinar. Yes, of course. So we'll be sending you the webinar slides. Every video that was played during this webinar, you'll be getting the link as well. And yeah, so I'm just going to delve right into the questions. So we've been having some questions. Our CEO himself has actually been answering some questions. So I'm just going to try to answer the one. I'm just going to try to read out the ones that have not been answered, and then he's going to answer them live. So, okay, anonymous attendee says, please, could you please restate the rebate rule?
Okay, all right. Yeah, there's quite a couple of questions here. I left that particular one because I think it's better to do that live rather than trying to type that out. So yes, the rebate rule is really talking about how we engage with you as a partner. So we operate in some form of commission model. So when we refer patients to you, we'll get a particular commission from you for that referral. I think it's normal. It's the norm in the industry today. When a hospital refers a patient to you, there's always a rebate as well. But the way it works with us specifically is that when we send that patient to you, first of all, you have to let us know your prices. We don't dictate prices for your investigations. You decide what those prices are. Now, when you send that list to us, you upload it using the process that we showed you in the video, the demo video. We have that information. Now, the patient will see those prices, and the patient will decide if he wants to go ahead to pay for it. So if the patient decides to pay for that, we'll receive the money on your behalf. And then as soon as you will also get the investigation request. And then as soon as you're done with the investigation and you upload the result on our portal, on our app using the process we've explained to you, once that upload is done for that investigation, you automatically get a credit in your wallet. And then you can withdraw that credit at any point in time. The difference is that the credit is less than the rebate in question. So the percentage that we agreed with in our partnership that we're going to be taking will be deducted before you are credited in your wallet. Anything you see in your wallet is your own money. You can just withdraw it to your bank account. So that's the summary of the rebate process.
All right, thank you very much, sir. That question has been answered. Another question is from Michael Jerome. He says, so API integration would do, yeah? So I think this is a continuation of one of the questions he asked before, where he said, can the test results be sent via email as an alternative?
Yes.
And then, okay.
Yes. So I've answered that initial question already, saying currently investigation request needs to be uploaded. So what we have is there is a notification that is sent to your mobile phone. So the app has a way for you to see the investigation request. There's an option on it to also upload that as well. We also would email you a link that contains a way to upload that investigation result as well using a web browser. So any of those two options works. You can upload it on a web browser through your email, a link sent to your email, and there will be an authorized email where you have to send that link to, or you can do that using the mobile app as well. So any of those two options work. Now, the aspect of them having to do this through API integration, we don't have that yet. I'm happy for maybe towards the end when we're done answering this question, I will open up the mic for some people. You can talk about what you mean by that and how you feel that would work. We're open. We're taking feedbacks from partners since we started this process. So if there's a way you feel and there's an easier way to do this with API, we're very eager to hear that, and definitely it will be considered.
All right, thank you very much, sir. Okay, this question is from Akinwumi Ayomide. I would love to have the link to the video. Okay, we would send that to you. Roland says, please, for the price list after uploading, would it be accessible to other partners?
Well, yes and no. So there is no place where other partners will go and see your price list and then start comparing that. But the truth is that other partners could also be patients. And so if there's a drug prescribed for them or an investigation prescribed for or requested for them by the doctor, they would see your prices when they get to that point. But there is no like a list where we are displaying your results side by side for comparison purposes.
All right, thank you very much, sir. Okay, there's a question here from, okay, that has been answered, from Gift Rufus. How can results be uploaded? Is it through the app?
Yes, so I think I've answered that already. There are two ways to upload results. One is through the app. The other one is through an email that was sent to you with a link. So if you click on the link, opens up a page, a web application, and then all you need to do now is to upload the result through that means. So those two options are possible.
All right, thank you very much, sir. Another one from Gift Rufus says, can a medical lab scientist consult a patient, like talk to the patient?
Yes, definitely. I think this came up in the last webinar onboarding that we did. Yes, if you need to talk to the patient, definitely the patient will be right in front of you there. If it's if the patient that came to your facility for the sample collection, and also if it's a sample sent to you, that obviously won't be possible. But there is nothing wrong with you having to talk to the patient.
All right, thank you, sir. Okay, Anonymous says, sorry, what percentage of the bill is the rebate?
So this is based on our conversation with you. If you want to partner with us, you can apply using the link shared in the chat, and then we would send you a partnership agreement and have that conversation with you. It's pretty the same figure for most people, but there are key cases where we make a little exception. And that is normally based on if there are like added services or some other extra features like home sample collection and things like that. But then we're happy to speak with you to kind of agree with you on what that value will be for you in your own scenario. All
right, thank you, sir. Chioma Adibo says, how many patients do you currently have in your database? And what is your plan to create awareness of this platform and recruit more customers?
Okay, so we're launching on the 18th of April, and I'm happy to announce to you that we have over 100 patients. I think it's getting close to 200 very soon. But we have over 100 today that are pre-registered, and we haven't even started asking patients to register. The doctors today are over 200 because we've opened up that platform already. And we believe that these numbers will grow tremendously. Now, what we've seen is the excitement and acceptance of this solution across board by the doctors, the med labs, the pharmacies, the reference hospitals, because of our solution and how it's built to be a win-win solution across board. So I don't think there will be any issues with getting patients on the platform. In addition to that, we're doing a lot of massive investment in advertising. We've partnered with a lot of media houses, digital media, online media, and we're also doing a lot of investment in that area to make sure that this information is sent far and wide. So be on the lookout. You see a lot of our messaging around. We've also done a lot of work to make sure that the system is also very user-friendly. We've learned from the mistakes the people that have tried to do this before have done, and we're building a solution that really works for patients, giving them that convenience. There's also a lot of work we're doing with a lot of conversations with HMOs today. We're talking to them about how they would come in, and then if once we sign any one of them, every patient in their platform automatically becomes a patient of CloudClinic indirectly. And then there's also a lot of conversations with retainerships as well. So we believe that getting patients into the system will be the least of our problems.
All right, thank you very much, sir. There's a question in the chat that I'm trying. Okay, Grace Bassi says, if we have a referral from you and we don't run one of the tests requested for, can we get it done in one of our reputable lab around and collect the results and send? Thank you.
So can you repeat the question again? I didn't get that clearly.
All right. The question is from Grace Bassi. She says, if we have a referral from you and we don't run one of the tests requested for, can we get it done in one of our reputable lab around and collate the results to send? Thank you.
Yes, I think that should be possible. However, we don't encourage that you do that. We really encourage that you only put up tests that you can do. Because if you think about it, right, the ones that if you're going to be sending this to another lab, then you're going to be marking up for you to make profit from it, and it would make you not to be competitive. And the way this works is that most patients will really want to go to a particular lab where they will see everything that they need, right? So if you have to start marking up, and then it will begin to affect your total pricing, and that might not be very good for you. So would advise you put up the things that you can provide, and only things that you can handle effectively with the right solutions, rather than having to report tests that you can't do, because you're also bound by certain SLAs, to make sure that you deliver within time. So if you start having to go rely on a different party, that won't be ideal. And the relationship we have is with you. So we don't have any SLA with this reputable pharmacy in question or med lab in question. So really, the rule here should be that you should put basically the investigation that you can cover.
All right, thank you, sir. The next question is from DK Alain of Afri Global. Welcome, Mr. DK. He says, does your process include health check packages and other bulk screening referrals?
Say that one more time. Does
your process include health check packages and other bulk screening referrals?
So we have a couple of conversations around this already. We have, different diagnostic centers that do those kind of bulk services, and they're coming to say, hey, we want to be able to partner with you to see how some of these services can be brought into our platform. And we're open to those conversations. So if you have certain health packages that you're doing and you want to bring that onto the system, onto our platform, we're happy to have those conversations with you as well, to look at the peculiarities on how this relationship can exist. Today, there is no bulk packaging on how we present tests to patients. But we're looking at, if you have specific use cases where this can happen, we can have this conversation. One thing I have to make very clear is that our platform is not such that we're selling tests or selling drugs to patients. We have a tailored system that works with a doctor speaking to a patient and understanding what the patient needs to do, and then recommending investigations to that patient. And then when they have clarity on what the diagnosis is, there's some medication that is prescribed to the patient as well. So we don't necessarily have to say, hey, go do this bunch of tests, at least not today. But there are conversations around that on how that can be useful to patients, and we're looking at that to see how that can be integrated into our platform.
All right, thank you, sir. There's a question from Blessing. She says, what's the agreement for home sample collection regarding logistics?
So for home sample collection, what we are doing is that there are also some partners that have that capability to provide home sample collection. So what we're doing is that we're having conversations with these people, and then we're looking at the capability to be able to carry out that those tests. So the things we look at is, do you have the right infrastructure to be able to deliver home sample collection within our specified SLA for that region? And then if we believe the partner has those capabilities, we can now talk about what the prices will be like. So there's the patient pays for the convenience of having to come to their home to pick up those samples. That information is passed to the patient when they are booking home sample collection. So that's not an issue at all. It's definitely something that we can handle.
All right, sir. Thank you very much. There is another question from Bumi Adetoro. Bumi says, if a patient wants to run tests through the app, will the prices of different labs be displayed?
If a patient wants to run tests through the app, will the prices of different labs be displayed? Yes. So the way it works is if a patient has some investigation request done for him by a doctor, we'll present to the patient the different, it has to be based on labs that are offering home sample collection for the location of the patient, and also by the location of the patient itself, the labs that are located close to that patient as well, within close proximity. So those labs will be presented to the patient, and the patient will make a decision on which one he wants to go to. Maybe because he knows that particular lab and he likes the lab, or he likes the pricing for that particular lab, in there, or the proximity for that lab to where the patient is currently is. And sometimes it might be that the patient is going in that direction and he wants to go there to do the test, because of that. So all of those options are there. The patient makes the final decision on which particular lab to go to at the end of the day.
All right, thank you. There's a question from Gift Rufus who says some investigations require some special conditions like abstinence and others. Will the doctors inform the patient or med lab scientists should do that? Also, some investigations have different turnaround time. Some will take up to a week. How can you undo the payment for such?
Yeah, so I'll take the second one first. So when it comes to certain investigations that take longer, we factor this into the system. We've done our analysis and we have an idea of the difference, how long different tests take. And then, of course, the doctors that are even recommending this test or investigations have an idea of this as well. So the way it works really is that we will always collect the money for the test when the patient pays for it, all right? The patient pays online using our app. But then you would do the test, and as soon as the result for that test is done and you upload it, that's when your wallet is credited. So if it takes a week for you to do that, once you upload the test result, that information is that money is credited to your wallet. So that's really how it's done. Now, for the first part, you're talking about some investigations require some special conditions like abstinence and others. Will the doctor inform the patient or the med lab scientist we should do that? So yes, typically the doctor would do that ahead of time, because if you look at the flow, the doctor would have a conversation with the patient using our telepresence technology. It's looking at the patient, it's having this consultation with him, and he's saying, I need you to go do this test that require fasting, right? So you have to go there. Don't eat in the morning before you go. So those conversations will be done by the doctor. So the patient would go there informed for that, and then we'll come with you prepared for that test. Our system is also providing means to make this process easier. So when there's a test that requires certain conditions, our app would also give you that information, and the doctor would see that as well, and it's prompted to let the patient know that this is what he's supposed to do. So that is all taken care of by the system.
All right, thank you, sir. There's a question here from Ify. Ify says, hello, is this open to mental health medications and addiction patients? Are there psychiatrists on this platform?
Yes, we do have psychiatrists on the platform. We have some already even signed up today. Yes, so if there are patients that are, the system is built to make sure that addiction is discouraged. So every single prescription that is done with that understanding in mind. So if a patient is coming to a pharmacy, for instance, to buy drugs, you would have to be provided with prescription form that tells you specifically what the patient needs to be provided with. So we do that. But then for a case where it is a patient that needs to do refills as well, which happens, that process is also there as well to make sure that there is no abuse that can lead to addiction. But if someone is already addicted, like I said, there's also a psychiatrist that a person can consult to go through a process of weaning himself off the drug.
All right, thank you, sir. There's another question from Mr. DK. It says, what is required in partnering with your HMO clients, bearing in mind that we also have partnership with most of the HMOs? Kindly explain how the handshake will be.
So in this case, you would not be partnering with the HMOs that we're working with. You'll be partnering with us. And then you'll be our third mile to delivering that service to our patients. If you have an existing relationship with HMOs, that is fine. This doesn't nullify it or affect it in any way. Remember, you still have patients that are walking into your facility to do tests. You will still have, direct relationship with organizations that have retainership with you. You will still have relationship with HMOs as well. You would see CloudClinic as another body that is coming in to really help bring in that inflow to you. So that does not in any way affect your existing relationships.
All right, sir. Thank you very much. Another question is, what is the spread of CloudClinic? How do you get patients for your partners who have facilities far from Lagos and Abuja? Yeah,
so we have the greatest number of partners in Lagos, Abuja, and Enugu today, but we're expanding quickly because the experimental consultation we did to learn and improve and iterate on the app was done in those 3 locations. But as we launch, we'll be expanding to across Nigeria. We already have partners coming from different states like Kano, Kaduna, I believe. We have some from Port Harcourt, we have some from Anambra, and many other states already are signing up already. So if you have in any locations, you're welcome. Send in your details. You saw the presentation we did for the app. The app allows you to really manage all these facilities, very easily, no matter where they're located. We have thought about all of those processes to make sure this is easy for you. So we're going to be sending, patients to you from, if you're located in any part of Nigeria, you should be talking to us about the possibility of partnering with us.
All right, sir. Thank you very much. OKK Emmanuel says, how do I promote my facility?
So right now there is no specific way to do any form of promotions. We've had a couple of conversations around how we can make it easy for partners to do some form of promotions. We don't have adverts on the app. There's nothing like that. One of the things that that you can do is really to work with us with our marketing materials, which will be given to partners, to bring in people into the platform. So what I mean by that is, if you have our roll-up banners, you have our stickers, you have our posters and things like that in different locations around your facility, what I would do is that there will be a lot of patients that are going to be coming to the platform within your location. And if you're a partner with us, that influx of patients into the platform within your area will bring in more patients to you, because there's a big likelihood that the rest of the people that are very close to you might not be partnering with us at that point. So that's one way. And then maybe down the line, we can figure out a way to create some form of promotions for you as well. We also have a ranking system for partnerships, for partners on our platform. So the partners are being rated on the platform. So if you're providing a service for our patients and your rating is 5-star, we will put you a little ahead of the ones that are less than 3, right? So the more ranked you are, the more your reviews, the more you will be put up on the platform ahead of others. So that will put you a little bit up, a little higher. Of course, the decision on who to use will really, at the end of the day, depend on the patient. But most patients will prefer to work with a partner that has a very high rating, because it shows that the other patient before him likes that particular facility. So that's one way to do that as well. Making sure that you're smiling and taking care of the patients, and that they can give you a good rating on the platform.
All right, thank you very much, sir. There's another question this person says, do you have consultant psychiatrists in your platform?
I'm not sure we have a consultant psychiatrist at the moment. No, I think we do. We do have, and we're open to more. I think we have one from Enugu, UNTH. I'm not sure. But I think I've seen one that's already pre-registered, but we're also open for more psychiatrists as well that can use the solution.
All right, thank you very much, sir. Chioma says, what is the criteria for ranking your partners?
So the ranking I mentioned is basically based on ratings. So on the page where the patient is making a decision on which partner to go to, the three things are presented to the patient: proximity to the patient, if the patient is walking in, and then the other one is price for the particular investigation, and then there's also the rating for that particular patient, that particular facility. These are the three things that are presented to the patient, and the patient has to make a decision on which one he would go for. And that decision is solely based on the patient.
All right, thank you. Blessing Umba says, is there room for patient reviews on the platform?
Yes, I think we already answered this one. The answer is yes. The patient reviews, the patient reviews the partners and also the doctors on the platform.
All right, thank you very much. That will be all of the questions we have. Yes, Gift, the links will be sent to you via mail. Do we have other questions? Very quickly, if you would like to speak, if you have comments, you can just raise your hand and then we'll give you permission to speak. If you have questions, concerns, or comments. So that's something we can do. So if you would like to speak yourself, if you don't want to type your questions, or if you have some concerns or comments that you would like to air, so you can just raise your hand and then we'll give you permission to speak from our end. But for now, these are all of the questions we have. I hope we've been able to answer everyone's questions.
Yes, so I was just corrected now that the question on patients, I read it wrongly, or maybe we read it wrongly. The question is asking, are patients rated? I think that's what it means. Do we rate patients? No, we don't rate patients. Patients are the customers here. We don't rate patients at the moment. The patients rate the doctors and the partners on the platform.
All right. Thank you very much. So that will be all of the questions. Thank you very much for sticking with us, everyone. This is a very, I'm using this opportunity to say thank you to all of the attendees. Thank you very much for joining us. Thank you to our CEO, to Mr. Ifeanyi Aneke, for taking the time and for explaining and answering questions in such detail. Thank you to our Flourish, our product manager. We have our program coordinator, Amaka Ezekwesili, Ejiro, our business development manager as well. Thank you very much. We also have Dr. Joseph on this call with us, in this webinar with us as well. Thank you very much. And also Miracle, our digital marketer, for putting this together. And of course, the engineering team for working very hard to build this app. Thank you very much. You have heard from us and you'll be hearing more from us very soon. The app will be launching very soon. I will be sending you all of the links that have been requested during the course of this webinar. Also, the webinar slides will be made available to everyone that attended the webinar as well. Thank you very much. All right, a question just came in from Okoli. Says, how do you verify the reliability of a lab result?
So the lab results are going to be vetted by the doctor. So if there are like typo errors that exist there, and it's something that the doctor can decipher and know, what the result really means, we encourage the doctors to go ahead, because I mean, just having something misspelled, and it's not necessarily a problem, it's not a challenge. But if there's a particular result that is bad, if there's a result that, for instance, we have a range that is way out of range, and it's clear that there's an issue with that result, the expectation is that the doctor would send this to a partnership support at CloudClinic.ng, and then we would resolve that internally and to figure out exactly what might be wrong in that case. So that's essentially what we do for knowing a result that is an investigation result that is wrong. It's the doctor that requested for that result that is able to vet that. Now, we really require that our partners, our MedLab partners, make sure that they don't put in a lot of erroneous results. In fact, it's part of our house rules that you cross-check those things before you send anything, because that is one of the things that can allow or that make us to unlist a partner on our platform. If we see consistent or obvious faults like that, a partner can actually be delisted from our platform. So that's discouraged greatly.
All right. Thank you very much. I hope we were able to answer your question locally. Thank you very much, everyone. In the absence of other questions, I think we'll be calling it a day. Thank you very much for taking the time to attend. My name is Ololade Olaleye. Enjoy the rest of your day.